Yat to he dan hidi nido del kudot saka hot zamda shikero shinna shindo den shinla da istra da do da benna aning da khegi do masane chinal nasengi kha da ni zino got ya mo na atle na kitchen da nishon ne kudo hanen hiji kunde di kosen skagina states da nasni di Nakaalishin agent dal nishigi hanet hijikonda yili le klo de bilagana miki at ton nanda da hon nishigi di kosinskagi nasnegi yanda halne. So say kudot so zin behande so kudoshi so del zindo leshi yingario at di jikwa inan khain lagi ba khni zindo kona ni ken hinne jenda has tikla Sashi ya ahandi konlana danzen of kada da ka halit shikado was danzen Sashi ya don daz nishta do besel je kondal ikta don daz nishi bini nagishun kon ki ken hinne ya da halia masan che nalata akonde kon ni Washington ne besel je det ane edo head and hidi nido lecho arts inspirasens die jod ado alsko ja nehlo beso do nehlo jo eben na chi ko da hije chedet ado ba heni zno de ni do koni ki keni na beso chi ko da ya gido ya hetan zndo a jo shi chi da yo ido le di nas ni eben na chi beso chedet ado o hedan di ni do le koni ki keni na sa cheda Zij is dat die aan die kon dat ontgaan de ka dat dat het ziet dat dat krijg dat is niet zo die jod zo als gewoon spelzen door zijn in de lage in le die jod ben in naai kodo die ken in wat zo deelzen zo dat krijg door lesto bin do jing do zo da di la kon hi ke ni namza yitsa da jitten tashi kon anil sko pandan hinne kon de edo jing di shiri yote o he kwa di jin kha ho aido inan kha in da do di de kusin ska in hast etsa da ya kon ni edo he jin hin na che hot da isil tsa den hinat ani zel in den linge eben na che kuya kon ni lote la ei kondo zel in den da hast khan khada hui ni hodi ne kudosh ni yote ara di kon ben ya sahin tlegi do ni na kha shane di li eben na chen hit zilo naso deni kato del shke dosh na kon ya hetan zingi do dibi krebi jini khana le konda Daniel nido dan hit zilo naste ni kash di yote he onto the zanebe hasi do le nje ni benache Jesus Christ amen. So we have these meetings every Tuesday, and people are starting to slowly transition back to, I guess, normal activity. Because of the low numbers, I think people are not listening in or tuning in, but we're going to continue to share with you what's going on, not just in Navajo, but in this country and all over the world. And I appreciate Deliazi at the Health Command Operations Center, the Navajo Department of Health, the Epidemiology section for updating us on a periodic basis on what's happening, on the other side of the globe and here in the United States and here on Navajo. And we see some very low numbers. Yesterday, just 2 people were reported to catch the virus. Thank God. 2 people, no deaths. If you put up the first slide, Eli, just gives you a rundown. I know some may say same numbers, but let me just go through it with you. See, where it says total confirmed cases, that's from the start of the pandemic to today. And that also includes, people that have caught the virus twice, maybe three times. So 52,822 confirmed cases, those cases that test positive here on Navajo. But look at what the total tests completed. These are tests that have been completed by the Indian Health Service. This is not counting the home tests. 500,000 tests have been given, over 500,000, 503,351 tests. Some people like me, multiple tests. You always have to be cautious. Every time we travel, we come back, we test. We encourage people, if you have some tests at home, there have been a lot of these test kits issued out to communities as well. If you have a sniffle, might be just allergies, but you never know. Just test yourself. Keep your family safe. Out of the 52,822 confirmed cases, what we have updated is 51,063 have recovered. Of course, these numbers need to be updated. Right now the healthcare facilities are going back to normal type of operation, meaning some of the procedures that were held off these 2 years or operations, they're starting to do those. And so sometimes the staff are not able to update these numbers on a periodic basis. But a lot of people have recovered, and we know that, family members. We all have been directly impacted by COVID-19 in one way or another. We lost a loved one. We know someone who passed. We know someone who caught the virus, someone who recovered, maybe have some long-term health problems. So we continue to pray for them. And we had a day of prayer last week on Thursday with a proclamation remembering those 1,658 people who have lost their lives to COVID-19. And so, and then negative tests, 394,494 negative tests that have been recorded. So if you look at the area confirmed cases, shows you all the service unit areas. Kudoi, Gamoe, Dantin, Jin, Da, Nisheta, Kons, the Zimbaho, Minina to the Zimbaho, Agi, Kun, Hikani, Hina, Yitza, that Denigiri, COVID-19, but Sado, Ebedeli, Asha Nezet, Asha, the meal Yashidova, Askan, Nezet, the Dova, Shlading, Baba, so sit, Nelta, A Kunik, any Hina, Nitza, now the image, Ako. Ebedeli, that's the Zimbaho. The that agi ni Washington as RGA snigo na that ande pinina pe ni ne koni keni nani za now the shinigi DJ ya dada ana kego ni keri na beda dolna jukare ya shon ya deskit akonda hadai no ne dishne kwende alla kon hiche ashane da yi do banan show yugo shibini na do babiga te dicha konde kudo khanda nishkin khalchin yigen and nigi andi kohane hije konda yili by here. If you go to slide 2, you have the last 14 days of COVID cases and COVID deaths. The darker color line is the COVID positive cases, and the lighter color is the deaths. As you can see, on March 21st, yesterday, only 2 people got COVID and 0 deaths. We have had very low number of deaths for 14 days. 4 deaths in 14 days. our thoughts and prayers go out to those families. Compare that with other jurisdictions out there. Um, we thank God for um, the low cases of both COVID positive and our death rate. Of course, one death is one way too many, as we always say. The third slide there shows the progression, that big spike at the end of the right-hand side of the chart. Guess what we went through? That was the COVID-19 Delta variant, Omicron variant. There's a new Omicron variant that's out there that has come into Arizona. Yazi will talk about that a little bit more today. So we got to keep our guard up. I know it's easy for us to say, oh, the virus is gone and we got low cases. Yes, we can celebrate, but we got to celebrate with caution. We're not out of this pandemic yet. We got to continue to wear our masks. It's still a mandate. Remind people out there. And if tourists are here or visitors are here, just a friendly reminder. You don't have to say, put on your mask. I just say, excuse me, here on the Navajo Nation, we want to protect you. We want to protect our families. And please wear a mask. It's as easy as that. Rather than say, put on a mask, give them the Navajo look. We don't want that. That's why when people kind of get upset. If you go to the next slide, that gives you an update on the age categories of people that have been vaccinated. Navajo Nation residents, remember 75%, over 75% of our Navajo people are fully vaccinated with the first and second dose. And next week, Eli will provide the booster shot percentage. It's over 50% because it changes, because of our vaccine cards. We can't all get our boosters at the same time. Remember, it has to be 6 months from the second shot. So some people got their second shot later, and so that means they don't get their third shot until 6 months after their second shot. So we'll get that. So if you look at the chart, those are 20 to 24-year-olds. We really need to encourage them. The reason why the 5 to 11-year-olds is pretty low is because they just recently got their approval to get them their shots. So they're getting their shots. What surprises me is the 12 and 19-year-old, 74%. And I said this last week. Students would say, "I want to go back to school. I want to get the shot and go back to school," and that's why I think they really have a high percentage. Then after that, the young people, 20 to 24, yes, you might think you're Superman or Superwoman, but we just got to remember, it's not for us, it's for our family, protecting our families, protecting our elders, because 20 to 24-year-olds, 25 to 44-year-olds, yeah, you might catch the virus and you might have asymptomatic. You're not going to get as sick because you're a strong body, but you can still pass it on. And COVID vaccinations do help push COVID away too. So remember that as you're thinking of possibly getting the shot, we encourage you to get a shot. Next slide there is we're in level orange, and the orange there, cases have their decreased over the last 7 days. And you can see the current response level met by indicator. So 50 to 99 cases per 100,000. So we're in orange status. Now, lab-based testing, that means not many people are going to go get tested and testing negative. We're actually in the yellow on that. But hospital bed capacity, we're in green. We're looking good in that aspect because not many people are in the hospital because of COVID-19. And because of wearing our mask, I hear people, masks don't work, I challenge them to look at what we're doing here on Navajo. Even our Navajo people say masks don't work. Look at what Navajo Nation has did, and it's because of each and every one of you Navajo people. Thank you. We are an example throughout this country of how we can push back on COVID-19, wearing our masks, following these protocols. And that's why people are not ending up in the hospital. And we're doing really well in that category. Now, the last one is the high-risk chapters. Now, we're letting our guard down in wearing masks, right? If you see the high-risk chapters here, it's quite interesting that majority of these are in New Mexico. And it's quite interesting that some of these communities that are highlighted are in the basketball state tournament. You know, I saw people not wearing masks at the games. We wore masks at the games. And, you know, this shows too that masks do work. But those of you that were wearing masks, thank you. I saw super majority of our Navajo people at the basketball games wearing their masks. And again, if you don't believe in wearing masks, look at this statistic. This data shows that wearing masks do work. So that is going to be our update this week, and I am going to turn the time over to Dr. Jill Jim, and then Dr. Jill Jim will hand that over to Deliazi. Thank you, Dr. Jill Jim, for your leadership, and we appreciate everyone's work. I know we're transitioning back to some normal, if you want to call it that, but we also got to keep our guard up too as we transition into this new way of living with COVID-19. And I asked Dr. Jim to talk about the fairs, the parades, the graduations, because the way it looks, if it stays like this, where it's low case counts, we'll reopen some of those, but we're going to have some protocols in place. So thank you all for listening. God bless you. Take care of yourself. Turn time over to the Executive Director for the Navajo Department of Health, Dr. Jill Jim.
Thank you, President. Ja, binnen wijsens aange zeg Dr. Jill Jim in Seattle. Dan en look on zo'n tretini basis ching da is saying dat het che dat zatan dat snelle ado na dus ander ai sin na shot da it's ispa hayan je begetin ching da washing kwa yeah ungenat ani bedini da President Nez and kwadi akwi shin kwadi nke de neid en jastke odo kwashin ashi anil trodais anil kwadi He changed on his at the biggest hit that the no do at anja that's a zone at the dot hit do on nishon do do ultra and do can in grocery stores do all class mask mandate at the at the halot do adoshin kwadi ni lot andakis do at the halina do the no shin clichin at Tendez do Ashin Kwaito Jobehazen do Jodi the Cosentrana state at the Halienigi, Jodi Laha only that the Nisa the Krishink at Delta do Omicron that they need the up do Omicron it do BA2 not that they know. Vision no halado saho nana do ein late one under do Oxford declare atin. It's iso nasni ho at the outdoor deho they go one ni ho at Asian I don't clear Delsi it's iso ya dot na do the sequencing that they inigi we a at the big echo a at the BA2 variant at the kohano that the nesto ato I sit on net when net asto I sit net whatsago she inta the di be he keta di nido at she be had the car at end that those are about da e she been not di at the no send that the network at nicht better hasen quite she di be ya de go to di is that and it on the she on the etas ke to she on the non the sheet has came the Kati Oshi Bata needs and do a what I don't quite him don hit don hinella dot any ban sita keso Kati at the Hasian the Nisha Ashi what so Ashi nos Kati Arquije kon kada di ka na nisho da ultra goda an ha sin bit ya dash hit do an hik eight a bit ya dash hit do tashi da do joik at has idan da shi aba da han sendo ado an da ke go to a what that do shi by yasins and da what an his chin on his biggest and biggest ke go sita an they at an shout at do a what ni hit the nangish and quadi between do bezebik at the askell a basha of dot so e ba ta no sendi I yese quadi an he as well do an he ba ta ni so they ya sto ado di there that any di at the we're in a major disaster declarations do at the at least by the Department of Health a major disaster declaration at the hadlo do ado the pandemic we're still monitoring the Aglichin at the Health Command Center at the hidden at the show. If you have questions, you can always call the 928-871-7014 number for questions and resources too. Other health facilities at the Bitin Data Stock again dahit at the yadail go dish hasan zago hodol just the pandemic kolgenigik on each eti kedo hashit antla the and in dahit so the laganik into a sustaining public health yeah Tatashi Ahawanta Dina Antini Ada Salado Tatashi chapter that the Kadi Eshi Kadi Ndaha Ada Hashit on hidden Bakati Jata Noshi Isto other tribal programs so ati bihin dailinas joka and hinat on it didn't digi the fair that any do graduation cause it bit all just anons do go do clashi hashit do behos and then hashit and dahit jo that the nito ado ati businesses that any do hashit that so on do nito that do that estada at on do nito an hite ya ati the nebike at the RU ati restrictions that any halo Asian hinagoshi a they lifted restriction a dojo kwato hidden nato on the after Navajo Nation, they don't have a lot of restrictions anymore. And IOA bahasket flatan on samba atiban this case, but on the hija go I you see ya the COVID ya honni for inda we call that a sustained downward trajectory but laganik etcha do go if it doesn't do a rebound, meaning there's no new surge we start making decisions to make sure that the numbers are going down. Although graduations were with Indian Health Service, tribal health organizations, and someone reminded me today that the pandemic has really helped us work together on Nishi. It's not Nishigi. It brought us together to work to save lives, and I hope we continue to do that. And so it wasn't entirely the case here on the Navajo Nation at times, but we were maybe working in isolation, but here on the Navajo Nation, the Health Command and with tribal leadership, we've been working together to try to address the pandemic. And that means making decisions to make sure that we are thinking of the utmost safety of the Navajo people and the lives on the Navajo Nation. So, and that requires looking after schools, over schools and making sure they're safe, and businesses So when we make decisions, I hope in the next couple of weeks, there'll be some decisions that we'll be making to kind of open the Navajo Nation back up, but making those decisions with caution and understanding that we're still in a pandemic. And that means graduation guidelines could be different from last year. This is the third graduation guidelines that we'll be making, and with the pandemic that still exists, and also making sure that schools operate these graduations safely. We did allow outdoor graduations last year and not indoor graduations. So those are some questions we're going to have to consider. And then also with the fairs, fairs can be done safely. They can be done. It won't be the fair that we've always experienced before. And I think the state fairs have functioned differently. As far as I know, New Mexico, I think, always was a little bit more stricter in doing the fairs last year. And I think hopefully this year we'll have some restrictions in place. And if the numbers continue to go down, I think there will be the possibilities of having those available on the Navajo Nation, but they will look different. And we just have to make sure that people are safe um, when they're doing those activities or participating in fairs. And fairs come with a lot of activities. It comes with a lot of interaction. It requires every age of our population to participate, from babies, toddlers to elders, and also in large crowds, and either in one setting or either either they're walking in a parade, or they're sitting and they're looking at entertainment, or they're riding a carnival ride, and they're eating. So, and there's a lot of also thanking the community by providing meals to the community. So there's a lot of interaction that goes into the place of fairs. And so we are considering those and looking at those guidelines. So I just want to let our people know here, the Navajo people, that the Health Command is still active and making sure that we provide services and keep everyone safe. So I will end my comments there. Make sure you all continue to wear your mask, wash your hands, watch your distance. So, and since Vice President has joined us, I want to thank him for joining us, and I'll hand over time to him, and I think Dell can go after Vice President. So welcome, Vice President, for joining us, and thank you for your leadership too. Yeah.
Oh, yeah. Thank you, Dr. Jim. Appreciate it. Yes, your leadership as well, presidents as well. It says you're right about working together, right? Just kind of the confluence of all kinds of minds, all kinds of professions, all kinds of leadership, oversight, just gelling together during the pandemic. So it's in a lot of ways it's amazing. In a lot of ways it's creatively interesting how it's all played out, and very important that it played out that way, to bring together everything. If you really do think about it, it's amazing. The CARES era, I guess we'll call it, and the ARPA, now some other funding opportunities coming to the Navajo Nation. We really should continue to focus on enhancing the quality of life here on Navajo. And as I say that, it sounds like it's catering to comfort. Not really. It's catering to needs, and should be maintained that way, bringing us up. Long before the pandemic, coming from the private sector, I always felt like the nation as a whole was 30 years behind the times, infrastructure-wise. And now that I'm inside the vice presidency, and it's not a negative aspect. It seems like we're more like 50 years behind the times. When you look at technology and its rapid pace, and we're not keeping up with that, then you're losing space, you're losing status, you're losing something that I feel in my private business life is, if you're not growing, you're dying, so to speak. You always need to be enhancing, you always need to be growing, aspiring, pursuing something greater than yourself, than what you have. So that is something I believe that is given to us by our Creator, to go and to take the land and to take and prosper, to subdue it, and everything is at our disposal, so to speak, to be stewards of the land, but also to advance and to grow. And when your people are prospering, as far as families are growing bigger, we need to create a larger, diverse economy in which to keep our people, our children here. And so when you are 50 years behind the times, you're always in catch-up mode. I teasingly and have said that we're not building back better, we're catching up. And so almost $3 billion to catch up with the rest of the United States. And so not that we're there yet, we're heading there, and we desire to get there. And so leadership really, we really have been working together. And to create a more impact using all these monies, we need to work even harder. It's what it's showing me, is what it's telling me, even to the congressional level, right? I mean, some of I have aspired to throw my hat into the congressional ring. That's what I've been told, is that we need bipartisan efforts to get any great work done. And so I guess we all represent that, a bipartisan approach. Why does President Biden call it the bipartisan infrastructure bill? Well, we need everybody to come together. And so that's what we've done here on Navajo, and we shouldn't be, segmented or ridiculed for that. We are all diverse. And when we have only a part of the heart of God, when you have only one segment of a political system, then you're missing a lot of points. And so, again, that's always what I felt. If you only cater to one group of people, you only have a part of the heart of our Creator. So, I do want to bring out, and then thank you for that, Dr. Jim. Appreciate your leadership as well. It made me think. You're right. She's right. So, but it's good. It's good. We do see our numbers come down here. Appreciate you all in with us March 22nd. For whatever reason, I know this happens to President. You get double, triple, quadruple booked for a time slot, and certainly that was mine. But we were talking to some bright minds in the economic realm, in the business realm, in the corporate realm, and really trying to kick projects loose here now. Much like Elon Musk had developed a relationship with the Nambe Pueblo, where they circumvented New Mexico state rule that car manufacturers can't sell directly to the public. Well, he's done just that. Forged a relationship with Nambe Pueblo. They utilized an old casino facility and refashioned it to become a Tesla showroom, and using our sovereign status as an unfair advantage. Wow, that's just exactly what I was thinking that bright minds can do, outside of the box thinking can do. And so as the vice president, I've always been looking at the nation as an unfair advantage. Let's utilize what money we do have and segment some for investment in our own projects, as we have to have skin in the game. But let's use it to leverage other money that's out there, whether it's humanitarian or social impact project money, whether it's corporate money, whether it's opportunity zone money. You can target with venture capital, VCs out there, growth funds that are out there, and really leverage by capital stacking projects. So we're using a small, minute amount of the Navajo Nation money, and yet we're enticing other monies to come and help us build it. Well, because we have skin in the game, we're committed to building out our nation, and that's what we've been working on. So just being transparent, and not that anything's more important than doing a town hall with you. It's just that the urgency and the fervency in which we're trying to advance our nation is apparent in Ned's lives. It always has, always will be, and so we do plan to work continually to bring about and enhancing the lifestyle here on Navajo, to burgeoning out healthcare, burgeoning out education, to increase and to work with what funding we do have, and then magnify it or multiply it by enticing tag along capital to come and help us build out projects. So it can be done. I'm fully convinced, and we've been having all these discussions. And so just 2 weeks ago, we talked with Che, I love his name, Che Huang. He took his company, Box.com, public, and he raised $900 million by going public. And we've been talking with him and just trying to kick loose some ideas, and they've been resonating discussions. So just letting you peer into what what has been ruling the roost here. And as we, our economic recovery work group and other meetings. So, but Shay Myron Leiser, Navajo Nation Vice President in the Comanche Nishla, Twa, and Bashes Chin, Updo Comanche Dashache, Glasha Dashanai. It's good to be with you again, March 22nd. Real quick, what the national looks like, and then I'll introduce Mr. Del Yazzie from our epidemiology department here on the Navajo Department of Health. The Biden administration lacks the funds to purchase a potential fourth coronavirus vaccine dose for everyone, even as other countries place their own orders and potentially move ahead of the United States in line, the administration officials said Monday. So it's jockeying for position there, even politics at the highest level, the world level, you know, we're trying to become stronger in that regard. Federal officials have secured enough doses to cover the fourth shot for Americans age 65 and older, as well as the initial regimen for children under age 5. Should regulators determine those shots are necessary, said 3 officials, speaking on the condition of anonymity to detail funding decision, but the officials say that they cannot advance orders for additional vaccine doses for those in other age groups unless lawmakers pass a stalled $15 billion funding package. So back to that bipartisan effort that I was talking about. We need all hands on deck here from all the parties to work together continually for the benefit of the people. No news from the Center of Disease and Prevention. In Arizona news, a little bit closer to home, Arizona's COVID-19 community levels have fallen into the low range for most counties in recent weeks. So they're experiencing what we're experiencing here as well. Of course, we do have 3 of those counties within our own holding here. Namely, Coconino, Yuma, and La Paz counties remain in the medium range. However, according to the Centers for Disease and Control and Prevention, the rest of the state looks to be numbers are falling. Arizona Congressman Tom O'Halloran said Saturday he has tested positive for the COVID-19 and is experiencing mild symptoms, attributing his mild symptoms to having received and being boosted with the vaccine as well. As of March 16th, total positive cases in Arizona, 1,992,471, with 5,153 new cases. Apache County, 22,126 with 95 new cases to report. Navajo County, 37,955 with 117 new cases to report for last week. And so coming through the 3-day weekend, numbers have fallen even more. And Coconino County, rounding out our Tri-County area here, 43,272 with 59 new cases to report, again, reported last week. Colorado, as of Monday, the state 7-day positivity rate was 2.56%, which is down from 2.93% 7 days ago. The positivity rate measures the amount of COVID positivity tests to the total amount of tests taken. Over the last week, 14 counties dropped to 0% positivity. Overall, 29 counties saw a decrease in COVID-19 positivity, and 23 counties saw a slight rise, where 7 counties stayed the same and 5 counties administered fewer than 10 tests. So that is for the state of Colorado, 1,334,194 cases as of Monday, yesterday. There, New Mexico, the Mexico Department of Health has modified its daily reporting of COVID-19 data, as I believe all agencies are changing up the way they report. Their data dashboard no longer includes a daily breakdown of new cases and deaths in each county. So as of Monday, yesterday, New Mexico standing at 516,512 with 346 new cases as of Monday. And San Juan County, nothing to report. And McKinley County, it's like nothing to report. They're probably just changing the way that their reporting is being reported. Utah, the last of our tri-state area, while our quad state area, my apologies. While state data shows 61.4% of Utahns were fully vaccinated as of Monday, just 27.4% of all Utahns have received a booster dose of the COVID-19 vaccine. Friday's tally marked the state's lowest single-day case count since March 25, 2020, when 40 cases were reported in the early days of the coronavirus pandemic. The next day, Utah reported 86 cases, the state data shows. So you're seeing numbers again coming down. Are we seeing the end of this? Still being cautious, and we need to be cautious. Total positive cases, 926,785, with 343 new cases in the latest 3-day weekend count. A little bit closer to home here, San Juan County there in southeastern Utah, 3,968 total cases, and our own Utah Navajo Health System standing at 1,960. So in closing, again, same old message. If you feel unwell and if you're unsure if it's COVID, you should stay home. Slowing the spread of the virus means taking those precautions, not only so that you can rest and recover, but it's really about keeping others safe. COVID-19 cases and hospitalizations are declining, as we heard Dr. Jim, and we'll hear continually from Dale Yazzie here. The COVID-19 vaccine has done a great job of limiting the spread of, more importantly, and protecting people from severe illness and being hospitalized. So that's the most important aspect of these vaccines is, should you get and contract the virus, that the symptoms, and what we're seeing, the data show is that the symptoms are less, severe, and that's a very, very good thing. Make sure to get your booster shot when you're eligible. So encouragement from the Office of the President, Vice President here. Shopping on the Navajo Nation is the safest and greatest way. As you know, you don't go venture out into known areas where it could be, a surge happening, where we stay home local, where we know that we can continue to open up and recover safely. And that's what we're working towards. So continue to buy Navajo, buy local, and we will someday soon see more opportunity. So let's continue to work hard. Let's all talk to our leadership and let them know what you think that they could work on to help us spend down this ARPA and get this budget passed, and let's bring projects to the Navajo Nation. So with that, I'll sign off here and alert Dale Yazzie from our epidemiologist, our neighborhood epidemiologist, to give us his updates. So I appreciate you. Continue to be safe, and until next week here, hug going it. Go ahead, Dale. Take it away.
Okay, thank you, Vice President. So hello, everyone. Thank you all for joining us. My name is Dell. I'm with the Navajo Epidemiology Center and also with our Health Command Operations Center COVID Epidemiology team. I'll provide some of the latest numbers we have here, covering a 2-week time period from March 4th through the 17th. But I would like to acknowledge and recognize our epidemiology team here. We are a large epi team from various entities that make up our team. So again, just our team, some team members, my colleagues from the Navajo Epi Center, also from IHS and the 638 facilities on the nation, and folks from CDC. The CDC Foundation are also helping us with our EPI team, and also just our COVID response overall. And from Hopkins and COPE, and also TGen helping us with the COVID strain surveillance. And then last but not least, our partners from the State Departments of Health from Arizona, New Mexico, and Utah. So this is the makeup of our EPI team. Just wanted to acknowledge and recognize them. So this is our recent cases and trends over a 60-day time period. This highest bar here is January 18th, and for a little over 2 months now, we've been on this downward trend, and we continue to see low numbers. So that's a great sign, which reflects the infection rate at 0.79, and our it remains below 1. So that's also a good sign. And then our case incidence across Navajo Nation, there were 81 new cases in a 7-day period from March 11th through the 17th, which puts our 7-day case rate at 51 cases per 100,000 population, which is in the orange level of our COVID response on the Navajo Nation. And that's why you see this orange box here. It used to be red. It was red for a long time. Probably last summer, I want to say like last August or September, it's been red, and just last week it turned orange. So that's a great sign, and we're very thankful for the low numbers we're currently seeing. Then on the map over here, this is, as you can see, all the IHS and 638 service areas, plus our bordering states are all in this 0 to 199 7-day case rate per 100,000. So again, this was also all red, but the red is gone, and so we are in this lighter shaded, brown colorish, brownish color across within our region and on the nation. So it's also a good sign. And some additional metrics we look at. This is lab-based testing capacity. So this is the 7-day test percent positivity rate continues to decrease as well. Last week it was 9. This week it's 7%. So continues to go down. And then there are 383 average daily tests were conducted every day over a 7-day period. So testing is decreasing as well, but there's still testing going on the nation. And then hospital capacity, as far as hospital beds and ICU beds, remain below 80%. 80% is our threshold, so this remains stable, and that's also a good sign. This is our epi curves for the entire pandemic. If you look all the way on the right side here, the blue line is the US, orange is Navajo Nation. We are continue to see this downward trend across the US and on the Navajo Nation. This is our 7-day case incidence rate comparing Navajo Nation to the 50 states and a couple jurisdictions. So this yellow bar here is Navajo Nation. We are at 32nd position this time around. So we've been hovering around here for quite some time. And as you can see, Colorado is top 5 up here, and Arizona, New Mexico, and Utah follow that. So we continue to see, COVID cases within our region, within our bordering states. So the COVID disease risk and transmission, continues to remain high, especially in Colorado. So our 7-day case rate, as you can see here, the 50 states and within our region, as I mentioned, Colorado, and seeing some of the increase in COVID cases over a 7-day period. And as you might recall, this used to be all red too. So within the past, 2 to 3 weeks, other colors have now appeared on this map. So I usually just cover the region within our region. These counties, this is Navajo and Apache County and McKinley County and La Plata County in Colorado are all red, meaning high COVID transmission still is apparent here within our region. Excuse me. And then there's this is San Juan County in New Mexico is yellow, which means moderate COVID transmission. And then also in Utah, the San Juan County in Utah is orange for substantial COVID transmission. So as I mentioned, the COVID transmission remains, either substantial or high within our region. This is the latest our COVID strain surveillance numbers here. So report 45 to report 46, comparing the Omicron variant and its sublineages. The BA2 was mentioned by President Nez, and so it did go down by one case. So as this yellow highlighted area here, Utah Public Health Lab did some quality checks on their Omicron sequencing data. There were some that were there was some duplication in some of the samples, so therefore you see this one case that was like one less case in the latest report. So for that reason, it's 1455 to 1454, and all the other variants remain the same. So, but I'll just mention the BA2 variant, which fits the BA sublineages here, fits under Omicron. There is an increase in cases with the BA2 internationally, like in China and the UK, and also within the US, like on the East Coast, like New York and New Jersey are certainly seeing an increase in cases with the BA2 Omicron variant. So, and I'll show in this next slide here, this is across the US for variants. So this purple, the colors is all Omicron. So the BA2 Omicron sublineage is now at about 35%, makeup of the Omicron variant. So last week it was at 23%. So it did go up by about 10, 11 percentage points for the BA2 sublineage. So it is increasing across the US, as you can see here, this pink bar here. And then this little one is the purple bar is the this B.1.1529, and then the BA1.1 is this darker shaded purple color. But the main concern currently is this BA2 Omicron sublineage. So we'll continue to monitor that. And then just, I think President Nez showed this slide. This is the high risk on chapters. For this time around, March 4th to March 17th, 11 chapters made the list. And these chapters have been on this list, or at least the red column over here, Red Springs, Crown Point, and Theroux chapters have been on this list for at least 6 weeks. So, and then just our last slide here, we continue to see a decrease in cases and have entered the orange level of our response. And then the BA2 has been detected in our border town areas of Navajo Nation. Our lab-based test positivity continues to decrease to 7% now. And then our hospital bed occupancy remains stable. And last, we are now, in the orange level for cases. Our lab-based testing is actually in the yellow level within this 5 to 7.9% range, and then our hospital bed occupancy or capacity is actually in the green. So, but if 2 or 3 indicators suggest different threshold levels, the higher level is selected. So the higher level is the orange color. So therefore, we say we're in level orange. So I'm going to stop here, and I believe I'm the last presenter. So I don't think anyone else is going to do a presentation. So I just want to thank everyone for joining us, and have a good rest of your day. Thank you.